you don't hurt anywhere else, just your arm? Okay, good. So we're pretty confident that the only injury here is probably her arm, and now we're going to try to make sure we stabilize it. But before we do that, I'm checking to see if she has any deformity. Deformity of the potentially fractured area means that it could at any time become a compound fracture, which means it could point out of the skin or break the skin, cause infectious problems with that, but also bleeding issues and bone fragments and other nerve injury involvement, things like that. In this case, it all seems pretty straight, and it just looks like it might be red and kind of swelling. So we're going to apply the normal treatment for any kind of musculoskeletal injury, and that's rest, ice. We're going to use some type of pressure dressing around some kind of a splint. Sometimes that's looked at as compression. Some curriculums are starting to say that's cold. Well, that's what the ice was for. E is for elevation once we have this fracture stabilized. And then we're going to take them on to the doctor's office and make sure that they get treated. So we're going to go ahead and make sure that this child self-splits their arm. Go ahead and take your other hand, honey, and hold your arm so it doesn't move. And I'm going to get some equipment so we can put a little split together for you. We're going to carefully place this arm in the splint. And then we get our wrap. Remember that when you wrap any kind of extremity, you always start at what we call the distal end or the far end of the extremity, and we wrap towards the body of the patient, making sure to not trap excess fluids and blood in the distal or the end of the extremity. Being careful not to excessively move this arm. Again, remember that this splinting is really just temporary to try to help stabilize the fracture or the potential fracture point. Now I'm going to go ahead and let you just put that there next to your body. And what I like to do here is kind of secure this arm around the patient's body to help them hold it. So we're going to bring that arm up, and I'm going to continue to wrap around the patient to help them hold it while we travel to the doctor or to the emergency room. And that just kind of gives extra support so that the patient can rest. They've been through quite a bit. How's that feel? Still hurt bad? Too bad? And then I'm going to pinch the nail beds on the distal ends of the fingertips to make sure that we've not cut off any circulation, but with half splinting that's really nice, excuse me, because we don't get into that accidental tourniquet with wrapping too tightly. We've immobilized the joint above and below the fracture or suspected fracture area, checking to make sure that we've got good capillary refill, to know that the circulation has not been obstructed at all. And now we're ready to continue on either to the hospital, to the doctor's office, and check this out with some x-rays to see if we actually have a fracture, or maybe it's just a bad bruise.